Rural health care is always a challenge. Well, Roger Musick, you live in Mitchell, South Dakota, somewhat rural. Many years ago, you were on your board of your local hospital, and you guys came up with some ideas of how to extend health care to further rural areas. Why don't you tell us a little bit about the grant, and we'll proceed with the conversation.
The Mitchell Hospital is called Queen of Peace. It's part of the Avera system that serves many hospitals in the Midwest. And our hospital was lucky enough to receive a grant from the Helmsley Foundation to do a telehealth system with the Avera system, and we were the first hospital to do emergency health care from Mitchell to Sioux Falls. Since then, the Avera system has expanded, and they serve about an 8-state area for rural health care, serve many hospitals, retirement homes, hundreds of them, matter of fact. I believe they're the largest telehealth provider in the United States, and continue to expand all the time, adding new hospitals and new facilities. They own a number of hospitals themselves that they serve, but they also serve a number of competing hospitals in other towns. And they do telehealth for emergency rooms, they do pharmacy, they do ICU, many different services. And fairly recently they've started going into direct healthcare to the customer. So they have an application that basically allows their doctors to serve the customers directly for minor problems. And telehealth has been tremendously successful in the Midwest, primarily keeping our small hospitals open. Instead of transporting the patients to the large hospital when they have something significantly wrong, we bring the doctor to the patient. Patient gets to stay in their local hospital, which they like, keeps the hospital financially viable, and continues to grow. And I think one of the most important benefits, it really makes recruiting doctors to small town hospitals much easier. No doctor wants to be the only doctor within a 50-mile radius of a hospital and has an emergency that maybe is beyond his capabilities with no help. This way he hits one button and instantly he has a whole team of doctors available to help him with that patient, and it makes the recruiting and you hear a lot of testimonials from the doctors about how many lives they've saved, and it's into the thousands of lives saved by having rural health care.
I would imagine there's a much faster response time as well.
Yeah, in the Mitchell Hospital, if you're in the ICU and the attending doctor needs help, he walks over in the wall and pushes a button very similar to a fire extinguisher button, and instantly cameras come on and they're hooked up to a doctor sitting in Sioux Falls that has about 8 or 10 monitors, and he can video conference with them, talk to the doctor. There is always a local doctor that is really in charge, but he has all the expertise that he could want. And they have a facility now in Sioux Falls that has, I'm guessing, maybe 50 doctors, something like that, on staff available. And most of the doctors that they have in Sioux Falls work part-time in the hospitals in Sioux Falls, and a lot of them work part-time in the telehealth. So they have some part of their week in a direct contact with patients, which I think is important for most people.
And from a cost standpoint, I would imagine just reducing travel time and stuff like that is a huge deal.
Yeah, it's really cut down the air ambulance requirements significantly. In the old days, you got sick if you were anything wrong with you significantly. There was a helicopter flew in and took you back to Sioux Falls Hospital. Now they try to keep you in the local hospital if they can. We still obviously have air ambulance to move people around, but a high percentage of the people can stay in the local hospital and get the expertise of the doctors.
And that's great for the patient too, because their family can visit them. And
yeah, most of the patients would much prefer to stay in the local hospital if they can, and then they get visitors from the local community, that type of thing. So it's worked out very, very well. I think it's a highly successful. One of the parts of the grant was we got the grant to help fund the initial operation and get it started, but it was supposed to be self-sufficient after 5 years, and they have achieved that goal. So it's a self-sustaining, growing organization that is very financially viable and very professionally run.
And implicit in this is broadband, right?
One of the things that really made this possible is SDN, South Dakota Network, serves most of South Dakota and some of the surrounding states. So they serve the Avera system and use a lot of their facilities to interconnect the hospitals in the South Dakota area, and then they interconnect with other states to take it to surrounding states.
One of the things, you kind of touched upon this, but patient health to the home, right? So tell us a little bit about that.
Yeah, they're just starting to get into the situation where they have an app, and you can bring up the app and talk to a doctor in just a matter of minutes. The doctor can prescribe medicine for you, can tell you if you should go to the emergency room, that type of thing. So it's a very low-cost way to get that first contact with the doctor without making an appointment, waiting in line, waiting to find the doctor when he has time available. So I think it's going to be a great first touch for the doctor. So you get your instant health care for the minor things and can then be escalated if necessary to the emergency room or other healthcare facilities.
And you're cutting out that windshield time, which is a big deal. So Roger, appreciate your time.
Thank you very much, Ken.